And it's only when I started working on my mental state, I realized that, it's not responding to any of those physical movements because of the crap that I keep feeding myself every day. I'm
Right.
doing what is asked of me, but it's not that because I want to do it.
Hello, and welcome to Healthify with Kamal, your weekly dose of hope, health, and happiness. I'm your host, Kamal, a certified holistic health coach, and as always, I'm joined by my fabulous co host, Reed.
Hey there, we're so excited to dive into today's topic of the mental aspect of being an autoimmune warrior.
Yeah, and for this, we have an incredible guest joining us, Damini Grover. She is a counseling psychologist, a master practitioner of cognitive hypnotic psychotherapy. She's also a ICF certified Heal Your Life teacher and life coach. And she's also the founder of I Am Powered Center for Counseling and Wellbeing. And you know what? If that's not enough, she found the time to author a book called The Intentional Being.
Wow. We'll be
Yeah.
having an engaging conversation with Damini about her personal journey as an autoimmune warrior, the impact of living with multiple autoimmune conditions on mental health, and how she, as a counseling psychologist, has found effective coping strategies.
Yeah, and this episode is not just for those dealing with autoimmune conditions themselves, it is also for their families too. I have my daughter who co hosts this show, as you know, and she has firsthand experience of being a family member, so this is going to be just perfect for us. And we'll be discussing how family members can best support and understand the challenges faced by their loved ones when they get diagnosed with an autoimmune condition. Okay, so let's get started with this. Hello, Damini. Welcome to Healthify with Kamal.
Hi, Reese. Thank you for having me.
Yes, so you know what? Let's start from the very beginning. Could you start by sharing your personal journey as an autoimmune warrior? And if you feel comfortable, tell us a little bit about what autoimmune conditions you've been dealing with.
Sure. So I suffer from fibromyalgia and chronic muscle fatigue syndrome, and I also have PCOS. So these are the three major things that I deal with on an ongoing basis. And I've also had conditions in the past where I've been operated for certain other things as well. So I've got a
Right.
long health history.
Yes. So you are just like me because I also know firsthand what fibromyalgia feels like on a daily basis, both physically and the mental toll it can take, you know. And
Absolutely.
overall, that must have been quite a journey dealing with so many different conditions, and I know it's not easy, but how has it been for you living with multiple autoimmune conditions?
So, like you said, Kamal, it's not easy at all. And fibromyalgia, chronic muscle fatigue, these are conditions that people don't know about. People, even if they know, they don't have like an overall understanding of what
Yeah.
all of this really means. In fact, even for me, it took me many, many years to kind of get the basic hang of what's happening within me and, in my body and how can I really manage it. Because at
Right.
the time when this happened to me, it all started after a head injury.
Hmm.
When the symptoms started to come about, and I went from one doctor to another, from one physiotherapist to another, but they had no clue of
Right.
why my body was behaving the way it was. Sometimes my shoulder was swollen, I couldn't move my neck, and I wasn't able to sleep. I would have these horrible headaches and blackouts, and slowly, I lost mobility in my shoulders. Over time, it impacted my back, then my legs. So I came to a point where I was the only thing that I could do really well was to sleep. And then over
Yeah.
time, that was also something that I was not able to do very well, because fibromyalgia, chronic muscle fatigue, these are things that impact your sleep as well. So I was getting into all of these conditions, and no one had anything substantial to offer. At best, they said that, fine, you have fibromyalgia, and this is something that you just have to live with. And I still remember that the most amazing definition I got, or the understanding that I got for fibromyalgia, was that, you're an intelligent and a sensitive person. That's why you have this. So,
Huh. I've heard
and
that
that
one.
yeah, and
Yeah.
that still haunts me till date. In that, and I was just 18.
Yeah.
When this happened, I just entered college, and to me at that point in time, it felt like a curse. I was like, no, I don't want to be intelligent. I don't want to be sensitive. If this is how it's going to, manifest. So it's been a very long, arduous journey. Of course, I've come a long way from where I started, where from being completely bedridden to now I'm as functional as anybody can be. But of course, it extracts a daily toll. It's not something that just happens to me, or naturally I wake up and then I'm ready to take on the day. No, it's not like that. And when the flare ups happen, they are horrible. And practically every second, third day, I get into a flare up, which takes about a month or two to kind of set back. So to reset in a way. So it's very, very difficult. And over time, earlier I used to think that, oh, I'm the only one who kind of goes through something like this. I hadn't come across anybody else who was going through anything similar. But it's only in the last couple of years that I have met people, or I've heard stories where people have been struggling with these kind of issues, fibromyalgia particularly, and just like me, they also went without any help. And then they gave up after a point in time, so their bodies are now the way they are. But I just wish more people knew about it, and still kind of they make that kind of an effort to do the best that they can to manage themselves. But yeah, it's not easy in any way.
Yeah, I mean, I can vouch for that because I've seen mom go through all of that, fibromyalgia, because like she mentioned, she has it. So I can totally relate to everything you just said because I've seen her go through all of that. And I think it's a really excellent reminder that even those who help others deal with their struggles are facing their own battles, like you mentioned.
Absolutely.
Yeah,
See, everybody has their own issues. And of course, being on a on the side of disease or any kind of illness or condition, of course it's not easy. It's torturous in a way. And to be on the side of a caregiver, even that is not easy. That comes with its own share of difficulties and issues. So I guess it's at times you feel like you're on this constant roller coaster, and it's on both sides. Because sometimes even you, when you're dealing with something of your own, you don't know how to kind of respond to that, and the person on the other side, even they have no understanding of how to support you. So it kind of takes a while till you get the hang of how to kind of synergize and manage things.
Yeah.
Yeah, being an autoimmune warrior myself, I mean, I know firsthand how ulcerative colitis, because I was diagnosed with fibromyalgia as a buddy to ulcerative colitis, which usually happens with most people. And it impacted my mental health severely because I was also very young, and I was a new mother actually at that time, because Reeth was only 6 months when I was diagnosed with all this. So I was 24 years old at that time, I already had postpartum to deal with, a new baby to deal with. I was somewhat newly married, because I had her very early on. So it was a lot going on. But could you shed some light on how living with these conditions has impacted your mental health? Because I know, like with me, as I mentioned, with everything else that was going on, this was just one more thing added to my plate, and I really didn't know how to deal with it. I felt very defeated most of the time. I would say like the first 5 years of having this, I felt very defeated, and I would go to the doctor and they would give me medicine. that was my round. That was it. I refused to deal with the mental side of it, So, how about yourself?
Oh, well, I echo your sentiments. It was just horrible when I got to know of it the first time. And in fact, it's not even that I got to know of it, because everything happened so fast after that injury. I was getting into one symptom after another, and I was running from, pillar to post, trying to figure out what is happening. And I was just 18, like I said, just out of school. It was in the first year of my college. In fact, it happened in the first month itself. And that rendered me quite helpless, in a way. And because, see, even when college, there's a lot of work that you kind of have to do. You're running around the whole day, and then even when you come back, you have some or the other assignment, and then you have stuff happening at home. And here I was not being able to do anything, and I had my entire future ahead of me, and to me it seemed like I have no future. So it did take a huge toll on my mental health. I became an insomniac. I was anxious the whole time. And I would, there would be times when I would just sink into this, pit of depression, and I'd be like, I won't be able to come out of it. In fact, for a very long time, I did go through depression. But then again, we don't talk about mental health, that at least back then we didn't talk about it that much. So because I was studying it, that kind of helped me in a way. But that gave me some sort of an idea as to what might be happening with me. But it was incredibly difficult, managing everything. And here your baseline is all off. You don't know when you're eating. You don't know whether your stomach is going to clear the next day or not. And I would have weeks where I haven't gone to the loo, and all because my system has gone into a complete dysfunction. And while it may seem like a very small thing, but it's actually not. If your gut is not functioning, if you're anxious, you haven't slept, your mood is all over the place, your functionality is all over the place. Forget being, productive or your, best self. That seems like a completely, non-existent possibility. I won't even call it a distant possibility. It feels like you're never going to get there. So it was really, really bad. And unfortunately, like we've been talking about how people don't understand, or they struggle to understand. So people around me also really struggled to understand. They had no clue of why I'm behaving the way I am. And I was also of not any help, because even I didn't know what was happening to me. So it was a huge mess that continued for many, many years, till the time I found, an approach that would possibly work for me. Before that, it was all like hit and try. Let's see if this works. So something would work for about a few weeks, then it would go off again. Then I would find something else for another month, maybe. And slowly I had to give up on all the things that I really wanted to do. So a lot of my choices were then based on the health conditions that I was struggling with, and that remains the case even today. Even though a lot of people think, and I've got these comments many times, that we it doesn't seem like you have any health issues. You just seem fine.
Oh,
You're
I know
doing
that
so
one
many
really
things.
well.
So and I'm like, am I supposed to just lie in bed and cry the whole day that I'm not being able to do something? Isn't the idea to kind of get up, go out there, and see what you can really do with your life, even though you're struggling with a condition? So I know, I mean, I'm saying it in a lighter sense, but these things do impact you, and that just tells you that people don't really understand, which is not that great.
I mean, the thing that you said, like, you don't look sick, I know mom's gotten that many times. From our own family members, she's gotten it, saying like, oh, you don't look sick. And we're like, how do you look sick? You can't
Exactly.
look sick, right? So, I mean, like you mentioned, chronic conditions can really take a toll on our mental state. And could you share some specific ways these challenges have manifested in your life?
Like I said, that for a very long time I kind of struggled with anxiety, because again, when you find yourself in any challenging, overwhelming situation, you are bound to get anxious, because that's your body's protective mechanism that's coming about. Your mind is feeling completely clueless. So I struggled with insomnia and anxiety all throughout my college years. and I just kind of manage them somehow. And again, when people are dealing with any kind of autoimmune condition or any other, it can, it can be any other disease as well, brought about by anything. The point is that anxiety is a very normal response that tends to take place, and of course, the intensities, the frequency, the duration, all of that can vary from person to person. But then again, that can take a toll. Secondly, whenever your body is under any kind of stress, your sleep and appetite are going to get impacted. It's kind of difficult to fall asleep peacefully, when you know that things within your system are not really right. And of course, for you to sleep peacefully, things need to be right in your system. So it's kind of a, you kind of get stuck in a cycle. So sleep issues become very, very common. And apart from that, you also have mood fluctuations, because if you're always anxious, or if you're feeling really low and hopeless and sad about things, obviously your mood is going to tank. A lot of negative thoughts, feeling really helpless, hopeless, getting angry, agitated, getting into outbursts, or even shutting down, feeling, you don't feel like talking to anyone, you feel like there's no point in doing anything. So all of that tends to happen. And then of course that all of these have their own repercussions, right? Your career, your relationships, other areas of your life that you want to focus on, your leisure, your hobbies, everything in totality gets impacted. So your mental health kind of is connected to everything that you're doing. And if your body is not functioning, there's no way that your mind will be immune to the kind of stress that comes with it.
Yeah, and one big thing with all these conditions is the uncertainty, of it. And that can be really tough to deal with. But how have you managed to cope with these emotional challenges that you've described while also trying to take care of your physical health as best possible?
So, I think when all of this started for me, there was one thing I was very clear about, which was that I will take baby steps and I will take each day as it comes. Because even though I was feeling really hopeless and helpless about, my future and how am I going to really do things, I somewhere, of course, wanted to do things. I remember getting into these angry fights with the universe or God, whatever you want to call it, that, what's the point of giving me certain talents or certain abilities if you had to put me in a situation where, I'm just stuck to my bed or I'm just stuck to my chair. There has to be something more to it. So I think I kind of found a way to sort of push myself, of course, which wasn't easy. But step number one was basically to tell myself that, okay, it's one day, one step at a time. Let me see whatever I can do. And I didn't put any unrealistic, I tried not to put any unrealistic expectations on myself, of course, but they did come along, because when you're struggling so much, there's also this, you kind of become very insecure whether you're going to match up or not, whether you will be able to do all the things that are expected of you, not just by other people, but even from your own self,
Yeah.
you know.
Yeah.
So there was this thing of managing all of that. And of course, I wouldn't have been able to do any of these things without two kind of therapies. One is, of course, mental health therapy. I started working on myself when I realized that I was getting into these very anxious loops and I'm not sleeping, and there's a lot of negativity that I'm getting filled up with and kind of losing it everywhere. So therapy helped me to kind of pull through, to make sure that at least I'm able to handle other areas of my life. Of course, it didn't do much for the physical conditions that I was dealing with, but it helped me to get into the kind of mindset that I needed to handle all of that. Like,
Right.
just accepting the fact that, okay, you're dealing with something that is not going to go away. You can't wish it away just like that. So, how do you really come to terms with it? How do you manage it and still kind of, make it a friend or make it a companion rather than treating it like your enemy?
Yeah.
So that was one. And of course, all kinds of physical therapies that I've tried everything under the sun. So whatever worked, I would kind of grab hold of that. And third, of course, because of all of this, I also developed PCOS. So everything kind of happened like in succession. So then PCOS was also creating its own issues in terms
Yeah.
of weight and in terms of, periods and hormones going haywire, which again was impacting my mental health.
Right.
So PCOS was also something that needed to be tackled. So again, getting into the nutritional side of it, the lifestyle side of it, it's taken a lot of work, and the work continues. It's not that okay, now it's done and I can sit and chill and eat what I want and just do whatever I want. It doesn't work like that. I've come to understand my body and how my mindset also impacts all of that. So that's the kind of work that sort of has gone into it, and it continues even today.
Yeah, the one thing is that I've noticed, I think you like dancing as well a lot.
Yes,
Yeah.
I love
Yeah.
it. I
Yeah.
love it.
Yeah.
I remember telling my physiotherapist that I don't care whether something happens in my career or not. Like, I don't know if I'll be able to do anything. But
Yeah.
if I can dance for like just 10-15 minutes, that's all I want. Can I
That's me.
dance? Even
Yeah.
during my flare-ups. My question always is, can I dance? And earlier I used to teach, and I wanted to get into professional dancing as well. I've taught for many years, but then because of this, I had to give all of that up. But now, at least, I'm in such a state where I'm able to go once a week for about half an hour or 1 hour. I kind of have to ration the energy I'm spending there, because then chronic muscle fatigue is also something that I get into. Exertion really tanks my body. Dancing is exertion, so all of that.
Yeah.
But if I can manage just a little bit of it, I'm good to go for the rest of the week.
Yeah, I'm the same way because I was really active in my college days in theater, in dance, and like I grew up dancing. You name it, I could do it, sort of a thing. And then being diagnosed with UC, with fibromyalgia, and then all the other stuff that comes along with it, everything that you've described. I had to give up majority of it, but still, just like you now, I do try to, even if it's just for 10 minutes, because that's all my body can take right now. But the joy that I feel like it's part of therapy, yeah, it kind of makes me calm
Yeah,
internally,
yeah,
makes me
because you
happy.
do need your regular, doses of dopamine, serotonin, everything, whatever gives you that
Yeah,
little bit of high, even if it's for just 5 minutes, because
yeah,
we all need something to push through. And it's very difficult because you understand that living with an autoimmune condition, it restricts you in so many ways. It's like you're living in a box and out of that box, which is very can get very claustrophobic and very frustrating and isolating. And a lot of
yeah.
things that we want to do, of course, they require our body. You won't use your mind or your verbal skills for everything. You need to go out there and move. So even if you can do that a little bit, as you said, that does work like therapy, because
Imagine.
it helps you to release a lot of stored up stress, at least.
Yeah. So, your background as a psychologist must have brought some sort of a unique perspective to managing these challenges after, like, I do understand that you were diagnosed very young, but like once you got done with your studies and as you got the knowledge, and now with all your expertise. So, could you tell us a little bit about how being a psychologist has influenced the coping strategies you found beneficial for yourself and also otherwise?
So I think being a psychologist has given me, I would say, just a slight edge over, for the lack of a better word, maybe a lay person who does not have an idea of those terminologies, for example, or certain tools and techniques. So the edge is in the sense of, like, of course, I'm more aware of what's happening. I'm able to, kind of come up with names and categories of what kind of things I'm getting into. I understand better what's causing my flare up. Like, a lot of times people don't have an understanding of what is causing their flare up, like to the extent that a lot of women still struggle to comprehend the fact that when they are PMSing or when they're on their cycle, their mood is going to change. Like,
Yeah.
feeling low, feeling lethargic, or feeling a bit fatigued is still like an alien concept to for a lot of women. Right. So, but then, of course, because I studied all of this and I've worked with so many people, I keep reading up about it and I've gone through it also. That's the kind of edge that I would say I have, that I'm able to pick up a lot quicker than most people at, that what's happening with me. And then I'm able to figure out, like, I have my toolkit that, okay, this is what I need on a certain day, this is what's not going to work. There are times when I know that I don't have an option but to just switch off. I just have to sleep through the week, like eat, sleep, eat, sleep. That's all that I can do to get my body to kind of reset and come back to normal. Sometimes it takes more than a week. Like my average recovery time from any kind of a flare up is about a month. So I have to ration everything. I have to slow everything down, stick to a particular routine. So I've been able to sort of understand that a lot. I understood that a lot earlier than maybe say most people. And if anybody I'm working with, they come up with any such concerns, I'm able to help them the same way, like when to see a doctor or when to see a nutritionist, because people lack that kind of an understanding. So I would say it's just a slight edge. I wouldn't say that it's done something drastic for me, because at the and I say that because at the end of the day I'm a human being who's also dealing with her own stuff. And if I'm telling other people that there's no magic wand that's going to make things go away, I have to understand that for myself as well, that it takes time and it takes patience, and you have to kind of train and keep training yourself as you grow and evolve.
No, yeah, I think it's like you said, you have to keep doing it because they're chronic conditions. So you have to keep working on yourself because at different ages and stages, your mental state is also very different because you're thinking about different things also. So, I mean, you've already given us a good example, but could you give us maybe like another example of how you've applied this in your own life?
Like I said, so one is like becoming self-aware of what kind of symptoms show up for you when you're, okay. So let's take it one step behind. So one is, and get as much as knowledge as you can about your condition, like what is fibromyalgia, what is chronic fatigue, and also I kind of went through a lot of literature to understand whatever was available at that point in time, basically. And then I spoke to a lot of people, so there was a lot of data collection that I did, so that and it's my process, it may not be anybody else's, but I'm just saying that these are a couple of things that I've used personally. So one was data collection, because information at that point in time was missing. We have a lot more info now. So that's that. Second was to apply that information on yourself. So I had to see which of the symptoms are fitting in for me, or how is my body responding, because your fibromyalgia and mine would be very different. The way your body responds to fatigue could be slightly different than how my body responds. How you are able to function would be different from how I would be able to function. So then there was a lot of building of self awareness as to what is really happening in your internal zone, both physically and mentally. Third was taking charge of the physical aspect of the disease or the condition. There are certain things which you just have to do. Like, for example, if you're talking about, say, PCOS, you have to correct your lifestyle. There is no option. Otherwise, you will be dependent on some medicine or the other for the rest of your life. But if you're able to really allow your body to heal nutritionally and get in some exercise, you can manage it a lot better. Right? So to understand all of that, so that's the physical part of it. And then also to understand that whatever you are dealing with, you're going through, that has a mental and emotional component as well. Right?
Yeah.
So taking
So,
charge of your mood, your
right.
anxiety, if you're going through depression, then that. There are times when you can get into a completely hopeless zone where you feel that there's no point in living. Yeah. So
Yeah.
kind of supporting yourself through that as well. So getting all of that in place is what I have done for myself, and I still do. And this is something which I think is, it needs to become the protocol for anybody who is dealing with anything. And then, of course, you have your family and social support, whatever it is that you can get, because even though you are the one who's going through all of these things, and yes, it's happening within your body, no one can get inside your body or your mind to feel what you're going through. But just having some kind of a support makes it a little, I would say, bearable, and makes it less isolating, in a way.
Yeah, so are there any other coping strategies, like maybe yoga, meditation, something that is both mental and physical at the same time? Like for both of us, somewhat dance is one of those things also that you found particularly helpful in overall managing with all these conditions.
So one, see, depending on the condition, it's of course it's important to choose the kind of activity that you would want to do depending on what you're dealing with and what your body is really going to respond to. But if I talk about me personally, what has really helped me, and also that's probably the only thing that my body can do, in a way, was one has been weight training. I do that because um why I say that, I mean, that's really important for me because I'm coming from a place where I could not even, lift my hand to feed myself. Like I had no strength whatsoever. I could not lift anything. I could not open the door. I could not, push it to close it. I could not sit for more than 10 minutes. I could not walk for more than 5 minutes. And all of that because, for a really long time, I think for good 7, 8 years, I went without any kind of assistance. I was just managing. So my body just, kind of tanked in all of these years. So strength training is something that was recommended because, we really had to build some strength in if we are looking at becoming functional. So that is something that I continue even now. And of course, it works as a great mood lifter as well because I struggle with a lot of fatigue. If I don't exercise, then on those days, my fatigue levels are pretty bad. My mood is pretty, sucky the whole day, and I'm struggling to just get out of bed. I can, I'll just sit there for like 2 hours and waiting for some motivation to kick in, but that really wouldn't happen. So exercise is one. Secondly, and of course there are different forms of exercises. So like weight training works for me. It works in PCOS as well. So that kind of takes care of both the things. It's helping me build muscle strength, which helps in fibromyalgia and dealing with chronic fatigue. So that my body's threshold to deal with exertion or to do more, I'm kind of working on that. That's how I'm able to do whatever I'm able to do. That's one. Yoga, of course, works. If somebody is not able to do all of that, like, weight training is not your cup of tea, or it's, it's not recommended for you, then of course, starting with some light form of yoga is something that works again wonders for your entire body. Going out for walks, because you're getting your vitamin D as well, and you get some me time, plus your body is mobile. So getting in some movement in any form that is recommended, second, that your body can take, is something that I would certainly recommend. And people don't understand that. Like I have one or two people in my own family who have struggled with fibromyalgia for a really long time, and and they went without treatment, of course. That was there. Second, there was no activity, like no form of exercise, which led to, the if you don't exercise, your muscle kind of gets into muscle disuse, which leads to more issues. So over time you're looking at like a lot more issues than what you started off with. But the minute they started to incorporate some kind of movement, whatever little the body could kind of take in, symptoms started to get slightly better. So
You,
all of this is there. And then I would like to add the whole nutritional component as well, because our gut is the third brain, of course. It impacts the way we feel, it impacts the way we think, and that's where our body is getting its supplies from. So the kind of food that you eat will also determine whether your condition is getting aggravated or whether it's getting healed.
yeah, no, I
So
think all the techniques that you mentioned are really great suggestions, because I think most of the things here on our podcast, we also mention like nutrition, activity, having some sort of movement, when not just in autoimmune, but otherwise also. But since you're an expert in cognitive hypnotic psychotherapy, what about the cognitive techniques? Like, how do you think they have contributed to your coping toolkit?
So again, I would say that, it's very, very important for not just anybody dealing with any autoimmune condition, but otherwise also to be very mindful of what your own thought process also is. Like you can be exercising and you can eat really well, but if your mental state is not supportive, your body won't absorb all of these things. Because to do all of these things, you kind of need to, get get out of your comfort zone. There is some discomfort that you need to bear along with the discomfort that anyway is coming with the disease. So working on that mental state is extremely important. And what happens is that when we are going through any kind of crisis, any kind of challenge, it's very normal and natural for us to get into a negative thought loop. And the more we kind of the stronger those negative thoughts, or the more frequent or intense they are, of course they're going to prove to be very damaging in the long run, because they kind of, again, they start taking your entire body down. Because whatever you are thinking, whatever you are telling yourself, your body is listening. So you can be exercising or doing your yoga and still tell yourself that, oh, I'm never going to get out of it, this is like never going to work, and I'm doomed to be sick all my life, and my life is a mess. There goes your yoga, because that's what you're telling your body. So your body is also like, oh, she actually thinks that this is not going to work, so why should I work hard?
Yeah.
Okay,
Yeah.
I'm not going to respond.
I'm sorry, just yesterday of what you were saying, I just wanted to echo that just yesterday I was talking to my husband, and that's exactly what I was telling him, that being somebody who's had chronic illness pretty much most of my life, it's been something that I've worked on to tell my brain that there's, you can do this, and you've got this, because I've realized that in the moments, when I was bedridden for like 9 months straight, as you're saying, like I couldn't even get out of bed. Those were some of the hardest times. And at that time, I really had to feed my brain the right messages so that I could just keep going. Because there were definitely days when I had this feeling of, I can't do this any longer. This just keeps going. It's never ending. Like even curse words were coming out of my mouth at that time, because it really does get to you. But at the same time, I think I've always been this kind of a person where I will say, okay, now let's clean up, pick up, mentally speaking, and keep going. You've got this. So it really does matter what you feed your brain. I definitely agree in that.
Yeah,
Yeah.
absolutely, absolutely. And I'm just as you were sharing your personal experience, I was reminded of the time when in my therapy, in my physiotherapy, they wanted to start some exercises because I had no strength. So, they said, okay, let's try with maybe just like a TheraBand with least resistance, or just lift your hand up and down, start doing it like 2 times or 3 times, and slowly you will pick up. And I remember that every time I would just move my hands, I'm just taking up my shoulder once or twice, the next day I am on the bed. They would try again, and then again I would be on the bed. So eventually everyone was like, okay, this is not working, because my body was not responding to even basic movements. And it's only when I started working on my mental state, I realized that, it's not responding to any of those physical movements because of the crap that I keep feeding myself every day. I'm doing what is asked of me, but it's not that because I want to do it. Internally, I have actually, I don't have any hope. I'm just like, you guys are wasting your time. This is never going to work. I'll never be mobile, and my future is completely like it's dead. Forget it being dark. The future just does not exist. So working
Yes.
on myself to, correct the self-talk and actually to get yourself to believe that it can happen. That took a
Yeah.
really, really long time. But I mean, it did happen, of course. But, talking about the mental health, yes, the kind of things that you say to yourself, they're very important because your body is listening. Your body is not disconnected from your mind. Every word that comes out of you, the kind of ideas, beliefs that you have about yourself, people around you, your own condition, they're residing in the cells of your body. So
Right.
one has to be very cognizant of the kind of things that we are entertaining in our own mind.
Yeah, no, I definitely agree. Like we were talking about nutrition being such an important component, but I think what we feed our brain, like ourselves, what we feed our brain, either can build you up or can break you down, one or the other. It's really a choice most of the time. I wouldn't say all of the time, but most of the time it is really a choice of what you do. And like you're saying, like when I first got my ileostomy bag, I did initially feel that I was doomed. My life is over now. What am I going to do? I'm just going to become somebody who's very independent. I felt that I would become so dependent on my kids, on my husband, my parents, like overall family, for everything. So I think I had like a pity party for about like 24 hours, maybe 48 hours. And then I was like, you know what? You need to get up and get over this. This is now it's a part of you. You need to keep moving. So, but also at the same time, like moving on, another aspect that actually most of us autoimmune warriors often deal with is misunderstandings and stigma. And I've had my fair share of misunderstandings and stigma about my um, first UC. I had mostly had misunderstandings about that because most people don't understand. To this day, people don't understand what exactly colitis is, and I feel that's the case with a lot of autoimmune conditions. And then there was also stigma, which we will be talking about just after this. But what advice do you have for someone who's coping with all this emotional toll of, having misunderstandings? Like how would you advise them to deal with that?
Um, I think the only way, not the only way, but perhaps a major way of dealing with all of this is tuning in rather than, focusing on what other people are saying, whether they're able to understand you or not. But it's just working on yourself with, being more intentional with your own self, working on your self awareness and building yourself up so that, you are not that impacted by what other people are saying. I mean, it's not going to be 100%. Like, there are times when people, for example, who are the closest to me, who see me day in and out, and I'll get some, there are times when I'm expecting, say, some kind of understanding or some kind of support, that, I'm really like dead and I'm going to collapse. You can see it on my face. Maybe you can, just get up and help me in some way, or, bail me out of this situation. But at times people are not able to read those cues. And then you have those, you'll have your friends, you'll have family members, or, anybody on the outside just pass some comments here and there about how you look, or, how it doesn't appear to be a certain way, or, oh, you should try this, or you should try that. And all those kind of things. The idea is basically to, again, I would say it's just tune them out, tune in. Because if you are self-aware, if you know in your heart that, if you've made peace with what you are dealing with, frankly, it's not about, by making peace, it's like, you know what all of this really means for you. You have your strategies and everything in place. Then it's okay. People can say what they want to, and you can use your judgment, whether, like it's a choice whether I want to kind of engage with that or not. And that's a training that you will have to give to yourself, because even the most understanding person in the world will still not be able to get inside your mind and body and feel your emotional or physical pain or agony. That kind of an absolute understanding does not exist. So that's the ultimate understanding that we need to come to within our own selves, that, it's okay, they have their opinions. Sometimes they'll understand, sometimes they won't. Listen from here, take it out from the other ear, use whatever you think is beneficial. Like, it's not that I have not made use of some random comments that were made, or, somebody just handed me down some random treatment. Why don't you try this? It worked for XYZ. And I dismissed it because, it came from it was said very weirdly or whatever. But there were times when I was able to use my judgment, and I was like, okay, what if there is some merit in what this person is saying? What's the harm in trying out? And then there were times when I've outrightly dismissed it. Sometimes when people crack jokes, or, people can be slightly, not slightly, quite insensitive. There are times when I've kind of, let that go, or maybe made fun of certain things myself. Sometimes I've kind of answered back. in a sort of an assertive way. So you have to find your own ways and use your own judgment. But getting bogged down is not the answer, and we do get bogged down because we are expecting people to understand all the time. That's not going to happen. That doesn't
Yeah,
happen on a general basis. So with autoimmune conditions or any disease that you're struggling with, which is just so specific to you, it becomes even more challenging.
no, yeah, I think what you just said is a really empowering perspective. But sometimes, despite all the efforts that you make, some people may still not understand. So, how do you suggest dealing with such situations?
Well, it would largely depend on who are those people first, because we can't generalize. And I mean, I would not recommend anybody, that you should generalize that anybody saying anything or they're not understanding you and you have to make it your problem. No. So first and foremost, ask yourself, how important is this person for me? How important is this person's opinion or perspective or validation for me? So it's the relationship that would matter. If the person is not that close to you, if the equation is a touch and go sorts, doesn't really matter that much. Why do you want to take on more than what you can handle? Why make somebody else's story your own story? Second, when we're talking about people who are really close to us, because yes, our friends, family members, partners, even they can, sometimes say things or do things. They may not mean it like that, but it just may happen. And then again, the idea is to use your own judgment, that when do you want to let it go? And when do you think, it's the time for you to have an upfront conversation, set some boundaries, because you know your body best. So, like for example, I struggle with a lot of fatigue. There are a lot of things that I'm not able to do, and my body also starts giving me signals every time I'm kind of stretching myself. So initially I struggled with it a lot. Like, I did not want to tell people. I did want to overcompensate, because that's how I thought I would be able to fit in. Otherwise I'll keep saying no to everything, and I would just be in isolation. But of course, that's something that I've worked on over the years. And today I say no very comfortably, that sorry, this is not something that I'll be able to do, with the understanding and the faith that people who truly love me, who truly care for me, they will understand this. They're not going to use this against me. Rather, they are going to come up with 10 other ways to support me. And that has happened. But you have to kind of, see for yourself the kind of relationship that you're in. Where do you need to set boundaries? You have to express your needs and expectations also. Many times, because, we get so overcome by our own limitations,
Yeah.
we shut ourselves in. We think that the only way to fit in is by sort of, keep doing what people ask of you, or what is sort of expected in a particular situation, but it doesn't work like that. So setting your boundaries, expectations, clarifying your needs, and asking for help.
Yeah. And what about the emotional toll that stigma can take? Like for me, I mean, I think I'm not the ordinary case. Like when I got my ileostomy, yes, I had my moments of where I was thinking what's going to happen to me, but not for a second did I feel shame of it, because I know that is something some people deal with. Um, so, how would you recommend dealing with stigma that sometimes comes along with certain conditions?
So again, like, how we accept any condition or any challenge. I mean, the first struggle is to basically accept a particular challenge or a condition that you're presented with and find your way through it. It's the same way that we need to deal with stigma, that, some amount of it is going to be there. You can't really help it. That comes from ignorance, that comes from lack of knowledge, that comes from, lack of, I would say a low emotional quotient as well. It comes from a lot of things, right? And of course, it is going to impact you. So nobody's immune to it. So one is acknowledging the impact that it's having on you. Many times we dismiss that impact on ourselves. No, no, it's okay. Like, it's fine. Yeah, I have this condition. So, the person is going to make that comment and people are going to talk like that. It's fine. We justify all of that just because we think that, we are carrying a limitation, but everybody carries some or the other limitation. right? So we need to stop justifying that. We need to acknowledge that impact on us, and then find our own ways to deal with it. See, this is something that's not that we can't do on our own. So you have to reach out to somebody for help, whether it's a therapist, whether it's your friend, sometimes, the person who's treating you, whether it's your nutritionist, whether it's your treating doctor, whatever it may be. But you need to find a helping hand. You need to find somebody who can validate you, and slowly you learn to do that for your own selves. It's not something that's going to happen overnight, and there is no trick that's going to make it very easy. Stigma is there, it is going to be there. You are going to take time to come to terms with it, and you have to put in that work on building yourself up accordingly. And as I said, earlier also, it is about tuning in. You have to go into the depths of your own experience. If you keep worrying about what other people are going to say and think about you, about your condition, that's not going to help you heal at all. In fact, that in itself is the root cause of so many diseases and so many mental health conditions that we get into, because we are more worried about the external world than what's happening within us. And stigma is the same. Tune out and tune in. Work with the impact that you are dealing with.
Yeah, and I just want to say now a quick reminder to you, our listener. If you're finding value in this conversation, make sure to hit the follow button on Spotify and leave us a review to let us know your thoughts on our podcast. Okay, so Damini, let's talk about the impact on family members, because me being a family member, so I'm my mom's daughter, so I can understand, and there were certain situations where I was like, how do I act or react, when she was feeling very low, or you don't know how to react in certain situations, or when she's very anxious. Family members of autoimmune warriors are also impacted by their loved one's condition. So how can family members best support and understand the challenges faced by them in their lives?
So a couple of things here. That one, like as I said in the beginning, that if being a patient, or being on the side of any disease or condition, that is very difficult. So is being a caregiver, right? And especially if it's difficult, no matter what relationship you share, because taking care of another individual is a whole deal in itself. A couple of things that we need to do. One is that has to be education. You can't help anybody, you can't even help your own self if you don't know what is happening within you or with the other person, right? Like if you want to help somebody, like today, if I didn't know what anxiety was, for example, I would not be able to help you or anybody else who comes to me and says I'm feeling anxious.
Yeah.
I have no concept of what anxiety is, right? So even for family members, it's very important to get yourself educated and familiarize yourself with what is the condition that your family member is dealing with. Number one. Number two, you also need to sort of mobilize support for yourself, in the sense that collect data, as much as information as you can, speak to their doctors, nutritionists, everyone. Be there so that slowly you can pick up different tools and techniques in different areas of your life, of their life, to support them. So that's that. Third is that it will take, as a caregiver, it takes time to sort of understand how your family member is responding to certain things. For some things, they will be very predictable. For some things, they'll be very unpredictable. So, you need to observe what is happening with them, observe their responses, so that you can figure out at least what are the predictables. Like, okay, if my mother doesn't get her food till say 11 a.m. in the morning, if she's not had her breakfast, she's bound to be cranky, or she's bound to be in a bad mood, or maybe she's going to get into a stomach ache, or she's going to have like an acid reflux or something that might impact her mood, right? So this is like something that you can predict, you can manage it, you can support your mom, or I'm just giving an example.
Yeah.
That you can support your family member, that maybe you should eat, otherwise this will happen, that will happen. Like, for example, this happens with me. So my brother, I come from a family of doctors, so thankfully they understand really well what hypoglycemia is. And with PCOS, it can get very difficult to manage, because your insulin drops. And if you don't eat, then I mean, for me at least, my BP drops, and I feel very dizzy, and I'm very cranky, and I get into brain fog and all of that. So if I am in a situation where I'm not able to eat, I know they are there to support me. Like my brother will quickly go and get something, or my father will drop in a suggestion, or they'll constantly tell me carry something with you, otherwise you'll get hypoglycemic. So those small things really help. Slowly, some friends and all have also started to pick up on that no, you must eat. So understanding for your family member, what are their predictables. For the unpredictables, you need to give yourself some time, because it's an unpredictable situation, right? You can't be there all the time. So that's that. And most importantly, also mobilize support for yourself. You will need to talk to somebody. You will carry that emotional impact, that baggage on yourself also. Because here you're dealing with your own life. We all have our own, we have 20 things that we have to deal with. And they keep changing depending on the stage and age that we are in. And then you add the responsibility of being there for someone when you don't feel that equipped. So it is important for you to have an outlet for yourself. So whether it's therapy, you want to join a group or whatever, but you need to kind of keep building your life on the side and give yourself an outlet as well.
Yeah, as a counseling psychologist, you definitely have a unique insight into challenges that are faced by autoimmune warriors. And I just wanted to know, what are some common mental health struggles that you've come across, and how do you address them in your practice? I mean, I know confidentiality is everything. I'm just asking for some examples. Yeah.
So one is how to, a couple of things actually. First is just working on accepting this new reality. Just because you've been given a diagnosis doesn't mean that it's going to become a part of your life from the next day onwards. So people really struggle to come to terms with this new reality and what it means for them, what does it mean for their life, their goals, their visions, priorities, everything kind of undergoes a change. So that's a very common issue that comes up. That's something that I'm sure you must have gone through. I went through this because my entire trajectory of life changed when I got into these kind of conditions, and it continues to impact the kind of work that I do, the kind of places I travel to, people I want to hang out with, the time that I want to hang out with, all of that.
Yes.
And it's a huge struggle. So one is coming to terms with that. Secondly is that it brings up a lot of, it is like an existential crisis that you're getting into. Like you don't know what's the meaning of your life anymore, because everything sort of just has gone for a toss, right? So again, adjusting to the new reality, figuring out the way forward, finding your own purpose, and making the most out of what you have. That. Third is that your relationships. How do you handle your relationships? What kind of long term goals? But sometimes it's about marriage, sometimes it's about having kids, it's about maybe locating to a different place, and all of those things come into the picture. So those kind of life struggles also tend to come up. And most importantly, it, apart from along with all of this, or rather at the heart of everything, it really impacts the way you think and feel about yourself. It shakes up your entire belief system, from being a really competent, driven person, or somebody who's got these great goals. It can just bring you down to someone who can't even imagine what the next day is going to look like. So you feel like a failure, you feel like a misfit, and you feel like you'll come up with all sorts of words for yourself, like I'm a loser and nothing is going to happen, so much of it. So, and it's not even the tip of the iceberg. There's so much else that goes on, but yeah, these are the common things that sort of come up. And then, like we've been talking about, dealing with stigma, and the fact that people don't understand, because dealing with any kind of mental or physical concern at the end of the day is a very lonely space. It's no matter how much support you have, it can be really challenging, and it can be a really lonely space that, again, sometimes even you wouldn't understand. Forget somebody else doing that for you.
Hmm.
So it's
Yeah,
really
no,
difficult.
I think that those are definitely significant challenges to navigate because I've seen mom go through them herself, when she had her series of surgeries and she switched to, having an ostomy. It She used to say all of this stuff to me because being so close, she would like open up to me and she would be like, I don't know how I feel about this. I don't know what's going to happen next. Like there was always a sense of fear. So, how do you approach addressing the issues that you mentioned with your clients?
It's time. I mean, of course, there are therapeutic tools and techniques, and that we, of course, have to put in place. That's there, but the overall principle with which we are using the tools and techniques is to help them to navigate these challenges, whether it's getting into, say, correcting their cognitive distortions. For example, there's a distorted way in which you're looking at things. You're saying that, oh, I'm doomed, and nothing is going to happen in I mean, I don't have a future, or nobody will ever love me. That's not exactly true. There would be at least one person that would love you. There would be at least somebody who's going to stand by you. But in those moments, it's so difficult for you to kind of gauge that. I mean, that happens with me till date. When my flare up happens, I feel that I hate everybody. Everybody hates me. Nobody loves me. Nobody is there for me, and I need to give myself a few days to get out of that thought loop and remind myself that actually that's not true. That's just my condition talking, right? So this is a training that I've had to go through, and this is something that somebody dealing with a condition will also need to kind of need to train themselves in. So thought correction is one, and then again, how you talk to yourself, how you're dealing with people around you, all of that takes time. So there's no one single technique or bunch of techniques that are going to work. You kind of keep coming up with stuff, but the overarching principle is that you have to give it time. You have to work on accepting certain things, figuring out what you can change and what you can't. That's the biggest thing that the biggest help that you can possibly give to yourself and to people around you, that look, this is what we can work with, and this is going to be just manageable. That's it.
Yeah, you mentioned loneliness, and in my early years, I used to feel very lonely because I felt nobody understood my situation. And actually, in some aspects, nobody really did understand my situation because to myself, just even the words ulcerative colitis, I mean, it took me time to learn to say the words first, how to pronounce them, because you've never heard a disease, right? Like that. And then just the whole aspect of dealing with it made me so lonely. And even to this day, I do have those moments when I feel extremely lonely and I feel like nobody's really understanding. Even like Reet mentioned, when they're offering support, they're trying to do whatever is best possible. But as you said, there is that you do feel that you're in a box, right? So these feelings of isolation, loneliness, how can a person overcome these sort of feelings as best possible?
So I think, see, the first step is to understand that some bit of loneliness and isolation is going to be there. It's going to catch you at some point or the other, and maybe catch you really off guard. Like, you may not be prepared for it, and you may be hit by those feelings. So just knowing that it's a possibility, that's the first step. And then it's about, like, this is something which I advocate a lot, that you have to learn to sit with your own discomfort. Your condition is not, if your condition is such that it's not going to go away, you have to find ways to become friends with it. So you have to be like, okay, yeah, loneliness, fine. You've showed up. Hi, come. Okay, sit. Let's just talk. What do you want to tell me? Right? How, and it's about having that conversation with yourself. Okay, how am I feeling? Why am I feeling this way? Allowing those feelings to surface, and then just give yourself time to kind of let the feelings subside. It may take a few hours for some people. For some people, it may take 2 days. For some people, they can be stuck in it like for a week. But the idea is to build awareness that this is something that comes, emotional ups and downs are going to be a part and parcel of the condition that you're dealing with. That's number one. Number two is accepting it and just learning to be okay with it rather than running from that discomfort. It's not saying, oh, I'm feeling lonely. Like, what do I do to get out of it? It's like, no, I am feeling lonely. I acknowledge that and I'm going to let it stay. It can go in its own time. And third is, yes, giving yourself some ways and means to release that. So journaling is one. Some people like to just, meditation works for some people. Some people want to call up a friend or a family member who has some understanding or, who they consider as their support system to, just talk and share that this is what's going on, this is what I'm feeling. Right.
Right.
So you need to figure out what is it that works for you. You can just cry it out. Yeah,
That
close the
helps.
door, scream your lungs out, but let that out. The idea is not to make it go away. It's not going to go away just like that. It's come
Yeah.
here for a reason, so you have to allow it.
Yeah, I think crying really helps, personally.
It
Yeah.
does. It does.
Yeah.
It's very soothing, and of course, that's your body and mind's natural way of releasing all that stress that you've been storing. And the problem actually happens when we don't allow ourselves that release. So the stress continues to kind of, you're already under so much of duress, and then you're adding more. So you have to give yourself a vent. But the idea is to embrace your emotions, accept that they are, if the good ones are going to be there, then the not so good ones, I mean, in a general sense, will also be there. You have to be friends with both because they're a part of you.
Yeah, but sometimes the fear of judgment might hold someone back from reaching out to get help, whether it be professionally, whether it be from family members. How can they overcome that fear? Because it is a very big thing that can hold you back.
Of course, it's there. It can be very difficult to reach out and ask for help for so many reasons, like judgment is one. And sometimes that judgment is not so much from other people as much as it's from our own selves. What will people think of me if I ask for help? No, somebody may not have said anything to you, but that's how you are viewing yourself, and that's again a normal, natural part, especially if you're going through a condition. Simply because we don't want to be dependent, and any kind of autoimmune condition or disease that will make you dependent on somebody or the other for something. That's also one of the things that sort of comes with it. So again, the idea is not to fight it and to understand that you can't do everything on your own. For some things you will need help, and once you do take that help, things will become slightly better or much better than what they are right now. So you have to tell yourself, show yourself the merit of taking help. We always look at the downside of it. Sometimes
Okay.
you have to do things because they are important, even if there is some judgment. But if you can see the long term merit of it, that's how you will be able to surpass the judgment. And after some time, when you look back, you'll be like, okay, it didn't really matter that much. But that's something that we have to kind of tell ourselves. It won't happen just like that. That's a little push, a little nudge that we need to give to ourselves.
Yeah, and okay, so now let's talk about, the unpredictability of flare-ups and setbacks that comes with having an autoimmune condition. So how would you suggest that one deal with that during those challenging times? Just out of the blue, you end up with the flare-up. Just when you think you're doing okay, you have a flare up going on. So how would you suggest dealing with that emotionally?
So I think again, it's about being observant of how a flare up is showing up in your body, number one. Because yes, it can be completely out of the blue, unpredictable, but there would still be certain symptoms which would be sort of, your baseline, or they would always be there. Like I know how fatigue shows up in my body. I know when my fibromyalgia is taking over, what is it that I kind of get into. It may show up unannounced, but when it does, I know what I need to do. So
Right.
you have to build that body awareness over time. Of course, that's there. And second, once a flare up happens, of course, you will have your own treatments or whatever it is that you're doing, depending on what you're dealing with. That's there. But one of the key things that remains common throughout all autoimmune flare ups is that you need to go back to your baselines. You have to go back to your sleep. You have to go back to your eating and pooping patterns, because they're very, very important, because your gut also gets stuck. right? So you have to make sure that your baseline is set, and you have to rest, and you have to cut down on all the junk and all that you keep eating, because that's the time when you kind of need to allow your body to heal and recover from that crisis that it's just gone into. See, a flare up also means that mentally what's happening is that your body's fight and flight response has gotten triggered. Like, it feels like something really bad is going to happen, or I'm going to die, what's going to happen. And obviously all the resources, like the reason why flare up happens and then our body systems also kind of go haywire, is because now your resources have gone into sort of managing that flare up. So the energy is not on other functions of the body. Like, for example, when I get into a flare up, my system completely shuts down. So I'm not sleeping, I don't feel hungry at all. I'm eating because I have to eat, but there is no sensation whatsoever. And my stomach wouldn't move for like weeks altogether. And I know that I have to just rest it out, and I have to eat clean, and I have to sleep. Give and see how much time your body basically needs to recover, because everybody's timeline is going to be different. But you have to go back to your baseline. That is a must. And if you think that your moods and all of that are also becoming unmanageable, then yes, you need to get support, especially during those flare ups as well, rather than that I'm going to seek support when the flare up has passed. No, even at that point in time, you need to have something that can support you.
Yeah, no, I completely agree. Self-awareness is very important, knowing what's going on and adjusting yourself to that. But I also think that self-compassion is just as important, especially when things don't go as planned. I've seen my mom as like beat herself up in her mind for not being able to do something when something unexpected happens, or if a flare up occurs and we have a trip planned and it doesn't go as planned. So, self-compassion is very important. So how should one manage expectations during these unpredictable times?
You just have to learn to tell yourself that it's okay. That it's okay. Like you said, self-compassion is important, and your body is doing the best that it can. So in that moment, it is about training yourself to be self-compassionate and be like, okay, things didn't go the way I wanted them to, and a lot of other stuff has happened, but can I really do something about it right now? If I can't, then I have to let it go. I have to tell myself that it's okay, at least I tried, and that there would be another time, because there would be. But for now, you just need to step back and tell yourself that it's okay. You just have to let it pass, or maybe find some alternatives. And yes, it's very easy to say all of these things. It's very difficult to implement, and I can completely empathize with both you and Kamal on this, because this is something that happens with me so often. I have to say no to so many things, and many times I've kind of said yes, okay, I'm going to do this, I'm going to go on this trip with you, and then after that my body has just gone into a flare up. Maybe because I walked too much, I sat for an hour extra, and my neck position was a bit off, and next day now I can't move my neck, and of course the plans have gone haywire. But what can you do?
Yes.
It is the way it is. Your body tried something, it did not work, and it is okay. It's like how you would deal. And this is something not just with our bodies, but this is something which we need to do for other things in life as well. Not everything that you're going to plan for is going to work out. That course that you wanted to do, that trip you wanted to go on, that relationship you really wanted, that it should have worked, it's not going to. What good is beating yourself up going to do? Nothing. So it is
Yeah.
about learning to drop the baggage and be like, okay, it didn't work. It's okay. I will feel what I have to feel. And when I'm slightly stable, I'll try again.
Yeah, when early on, I think with women, because primarily women get diagnosed with autoimmune conditions a lot more than men. And so women in general have so much guilt going on about taking care of everybody and then putting themselves last, that syndrome that we all deal with. And then you add to it autoimmune. And if you are a mom, that's just a whole lot of new layering going on there. So, and I had a lot of mom guilt as far as expectations is concerned, because like you're saying, my body wouldn't allow me to do so many of the things early on when the kids wanted to do. And I mean, they're fully grown now, but when they were younger toddlers, running around, and my body was saying, no, you need to sit down, you need to sleep, you need to eat, you need to do this. And I had two kids to take care of at the same time. Um, at one point, I really had to feed myself. Again, going back to feeding your brain part, I really had to feed myself that you are doing the best possible, that your body is allowing you. It's okay. Your kids are doing good. And then over time, I think I'm very lucky that not just have they adjusted, but they really do understand. So over time, we've started to plan accordingly, whatever it is, just our daily lives, or anything special going on in the family where we have control. Obviously, like, if the situation can be controlled by us, we're planning a trip, we're doing whatever, then it is a consideration. Okay, so mom can't climb this mountain, we can, so maybe she'll just wait for us at the bottom with whatever. And mom is fine with that. Mom is happy actually that way, because then the guilt is not factoring in. So I definitely agree with everything you are saying. And going back to all the self-care tips that you were saying, that are beneficial to an autoimmune, conditioned person, like the sleep, the food, the taking care of yourself. We so often forget that, yes, we may have a disease, but we really do need to take care of ourselves. And because we have a condition, it just makes it that much more important, you know. Um, and I've been very adamant about uh, doing that and trying to be my normal, because I feel everybody's normal is different. Even though, yeah, because we say normal, but I don't really think there is such a thing as normal, because everybody's normal is different. And pretty much in every episode, the one thing I keep repeating is that you're unique, your situation is unique. And as we are saying, we both have fibromyalgia, but our bodies react to it differently. We deal with it differently. It affects us differently. So everybody is unique. I'm like, yes, definitely in that. Okay.
So, yeah, I think
Yeah.
it's about understanding that, when we use the word unique, we are not saying that you're extraordinary or you're special.
Yes.
That's why people have difficulty in, acknowledging the term or really like applying it to themselves, because, oh, I am not special.
Yeah.
But unique simply means that, yes, you have your own individual personality, which is not like anybody else's. And
Right.
your body, your needs, and everything are going to be very different. So if you keep comparing yourself to others, or you keep forcing yourself to be like somebody else, you're never really going to be your own person, or you'll never be able to navigate your own challenges effectively.
Right.
So you are your own person. Your body has its own personality. You have your own way of thinking, and you have to learn to, acknowledge and accept and, make friends with that.
Yeah.
Yeah, and with so much information out there, I mean, everybody's saying something about everything, social media, the internet, there's so many blog posts, articles. How can somebody actually figure out what self-care practices work best for them?
I'd say, like you said, there's so much of information. So one, it's about picking up credible sources. Maybe picking up, research journals, articles, somebody who has worked in the field, and, picking up their work, asking your own people that you're working with, your own nutritionist, your treating doctors, and, all of that. So that's there. And of course, then you have your friends, people who are dealing with, similar conditions. Like if something has worked for me, so tomorrow when somebody asks me about what has worked for you for fibromyalgia or for managing your fatigue, I'll be able to tell them this is like first hand information. So, being a part of a community of sorts, or, being in touch with people, getting in touch with people who have some shared experience, those are the ways where you can pick up self care practices. And then, of course, at the end of the day, it's about trying things and seeing what is going to work for you. Like, yoga never worked for me. Yoga works for everybody, but that sent my body into such a bad flare up that I actually became phobic of yoga. So it never really worked. It's only now, like slowly, when my body is more receptive, it's in a better condition, strength wise, I'm slightly better, that I'm able to do it. But back then, like, when somebody had suggested yoga, everybody talks about yoga, but it didn't work for me.
Yeah.
So you have to also see at the end of the day what's working for you, not just because somebody's told you this, but you have to try it out for yourself as well.
Yeah, no, weight training worked for me too, more than yoga. I will agree to that. Definitely. And, we've been talking about harnessing the power of your mind to enhance your physical well-being and also like your overall quality of life. You really have to tell yourself that. So, how can one really incorporate that into their life, especially with chronic illness?
So one is, like, I would reiterate the power of self-awareness, because awareness is the starting point of everything. If you don't know how something is showing up, why is it showing up, like, what are the different ways in which it manifests, even your own thought process, you wouldn't know the next step. So one is working on your self-awareness, and then it's, of course, you kind of take it from there. So that's one. Second is becoming friends with your own emotions, because, like I said, this is, at times it can feel like you're in a roller coaster. So your emotions are all over the place, and emotional management is something that everyone struggles with. So
Right.
we're okay when we are, on our good days, we have nothing to complain about, but on the not so good days, and if you are not able to manage your emotional state, say during your flare ups, that is going to aggravate your condition even more. So, like, for example, if I'm really anxious in a particular day or during my flare ups, I know my lower back goes for a toss. I know my neck is going to become even more stiff than what it already is. So, I need to have my ways to manage all of that. Right. So that's these are the two main components of working with your mental health. And then it's also about instituting certain practices that can help you to do that. It could be journaling, it could be meditating, it could be, just taking out 15 minutes for yourself where you're just all by yourself, going for a walk, you're listening to some music, right? It could be mandala coloring. Therapy is one, right? You want to be a part of some self-help groups, or start or read more about self-help and all. So these are the things which you have to kind of keep putting in, you have to make them a part of your daily life, because, like, you're learning so many things about your body, you have to also learn about your mind as well.
Yeah.
Yeah, and you are somebody who understands both the professional and personal sides of being an autoimmune warrior. So, what message would you like to share with those who are navigating their own journey?
I would tell them that, it's okay. And this is something that you need to learn to tell yourself also, that it's okay if you're struggling. It's okay if you're not being able to do a lot of things. It's really okay, because you're dealing with something that is not entirely in your control. So you have to give yourself certain okay days. You have to be patient with yourself, and you have to invest in your self care, because it's not that if you've been diagnosed with an autoimmune condition, your life is over. But if you think like that, then of course there's nothing really left to look forward to. So you have to learn to accept it, make it a part of your life, and see what are the other things that you can still do. It's like saying that one door closes, another door is going to open. But for that, you have to be a little patient with your own self, with your own condition. So it's okay. Give yourself time and be patient with yourself.
Oh, that's great advice, I think. So before we wrap this conversation up, Damini, could you please tell our listeners how they can get in touch with you if they are interested in working with you and your expertise? And they should be, I think.
Thank you. So, well, I'm on social media. So they can get in touch with me through Instagram. My handle is Damini.impowered underscore. I keep forgetting it. So that's the one. They can go on my website, which is daminigrover.com. They can
We will
email
also
me
have
on,
it.
Yeah.
yeah. So it's on my, and you can reach out to me on email, info@daminigrover.com. You can drop me a mail and we can, that's how you can, that's the best way to get in touch with me actually.
Yeah, that's fantastic. And to our listeners, if you're seeking guidance, empowerment, and insights into managing your autoimmune conditions and mental well-being, do reach out to Damini. I think it will be really helpful to you. And don't forget to let us know how you liked this episode. As always, your feedback means the world to us.
Yeah, absolutely. And you know what? I've really enjoyed this conversation for two reasons. One, to get your professional insight, and two, it's always good, when you talk to a fellow warrior, and especially if that warrior happens to have something you have, you just feel a little less alone in the world. So I want to say thank you so much for joining us for this episode. This was much needed. We need to have more conversations about the mental health in general and especially for chronic illnesses. So thank you so much, Damini, for joining us.
Thank you, Kamal. Thank you, Reet, for having me.
Yeah. And finally, if you found inspiration and valuable conversation in this, because we discussed everything about mental aspects of being an autoimmune warrior with Damini, I hope you give us your feedback because it's much needed.
Yeah, and your journey is unique, and no matter the ups and downs, know that you're never alone. And we're here to provide you with information, inspiration, and a sense of community.
Yeah, and just last reminder, just like Reed said before, do follow us on Spotify and leave a review. And that just keeps us more motivated to bring you more conversations like this.
Yeah, and until next time, stay healthy and stay empowered.